DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us today. We have a special guest, Dr. Chance Armstrong. We're at Auburn University. We're going to talk about breeding soundness exams and bulls and a whole lot more. Thanks for joining us. Stay tuned and enjoy the show.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with Dr. Chance Armstrong. And Dr. Chance is an associate clinical professor in the Department of Clinical Sciences for Food Animal here at Auburn University's College of Veterinary Medicine. You're so dang busy to get you to get in here and sit down and be on this. Thank you.
I'm very humbled and honored to be on this program. I've watched it for a long time, so to be on this is almost like one of those monumental things in food animal where you make the cover of Bovine Veterinarian or when you make DocTalk. Very special. So thank you for having me today.
Well, thank you. And today we're going to talk about breeding soundness exams.
Something near and dear to my heart because it's really important to the profitability, sustainability of all beef operations in the United States and also into Canada. You can tell that by some of the NOMS data that came out, how over 90% of operations utilize a bull for their breeding purposes. And so understanding how they're performing before they go out is really, really important for us to do every year on every operation, no matter how big or how small they are. Something that we should be focusing on and a part of every preventative health maintenance program in the United States.
And it's not like once every 3 years or once every 5 years. You recommend we got to do this every year.
Yeah, one of the limitations of the exam is a snapshot, and so we want to do it about 30 to 45 days prior to the breeding season so we can have a relative idea of how he's performing right before he goes out, but it also gives us an opportunity to change some things, or in instances where the prognosis is poor for him returning to breeding soundness, it gives the producer an opportunity to find another bull to replace him in the bull battery.
Yeah, and this is something that I can't imagine with the what's at stake. This is pretty cheap insurance, isn't it?
I mean, everybody, when I talk to producers, one of the favorite things that I do, I ask them, who came here tonight with insurance on your health, insurance on your crops, if you have them, insurance on your house, insurance on your vehicle? And everybody looks at me like I got 3 heads, and they say, of course I do. Like, how could you not take out this cheap insurance policy on the profitability of your operation? So it should be something that we all invest in every year, and some data out there has suggested a $7 return on every $1 investment for this exam, and that's been published. And so it's just a no-brainer. It's a core part, what I tell producers.
Yeah, and to get the return on investment, I mean, we unfortunately hear the horror stories of when someone doesn't do this.
Yeah, you don't want to find out that he wasn't performing well at preg check because then you have no return there. And so it's something you want to prepare for. And again, preventative health maintenance program, this is an essential part of it.
Yep. And again, just for the timing purposes, 35 to 45 days before the breeding season, just so if there is something wrong, we can either help them get better or find a replacement.
Yeah, we can change some things in that time, whether it be nutrition, whether it be a lameness. We can also do preventative health maintenance at that time, such as vaccinations and foot care. And then again, if it doesn't have good prognosis for return, even with therapy, I'll have time to find a new bull.
Sounds great. We're going to take a break. When we come back, more with Dr. Chance Armstrong. You're watching DocTalk. We're glad you joined us.
Hi, my name is Dr. Kirk Ramsey. I'm a professional services veterinarian with Neogen. So today on Cattle Intel, we're going to talk about calf pullers or calf jacks. Now these can be an incredibly useful instrument to aid in dystocias or difficult calvings. So a calf puller is pretty simple. It consists of a long metal bar, a front cradle, and a jack with hooks and a lever. The jack is used to provide consistent pressure on the legs of the calf by pulling the chains applied to the calf's feet and legs. So we position it by placing the cradle at the end of the jack at the back of the dam's legs just under her perineal area. The lever is then moved back and forth, which moves the jack rearward on the bar. So when the chains are tight and force is being applied to the calf, the bar is gently pushed downward toward the ground using leverage to pull the calf. We repeat this slowly and gently as the calving progresses. Doing this applies downward force to the calf, mimicking a more natural birthing position. This is the correct way to use a calf jack. Unfortunately, they're often misused by only applying pressure exerted by the jack and not using the bar as leverage. This only applies direct backward force on the calf, which is unnatural and often leads to further dystocia complications and typically will harm the calf and the dam. A calf puller can be incredibly useful when used appropriately, but should only be used by individuals who've been properly trained. So remember, a calf jack can apply over 2,000 pounds of force, so use it with caution and really only use it when deemed absolutely necessary.
Thanks for watching Cattle Intel by Neogen.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Chance Armstrong. We're at Auburn University where Dr. Armstrong serves as an associate clinical professor in clinical sciences within the College of Veterinary Medicine and is a world-renowned expert in bulls and beef operations and bovine medicine in general, but we're talking about bulls today. So just kind of walk us through the parts of a breeding soundness exam.
Yeah, what producers should expect and what veterinarians should provide is a complete breeding soundness evaluation, and that's made up of 4 parts. They're all cumulative, and so they build on one another, and no one part is more important than the other, so it's important that we look at the bull as a whole. The physical encompasses the biggest part and the most time-consuming part of the exam. We have minimum scroll circumferences per day of age that's been set forth by the Society for Theriogenology, which we found in the data from the literature that it's really important for the onset of puberty of the daughters that bull sires compared to his contemporaries. And also, I tell producers, a bigger factory is going to produce more product. And so a bigger scroll circumference is something that's been desired and been selected for by many breed associations since really the late 70s. And so the scroll circumference is a part of that. They must meet the minimums to pass the SFT guidelines. And then we look under the microscope. Once we get a collection of the semen, we're going to look for progressive motility or how they're moving. And then we're also going to look, which is really, really important, we found that the number one reason why bulls have failed or marked as deferred qualifications over the last 30 years is because of poor morphology or how they're shaped, meaning they could be moving, but if they're not shaped correctly or there's something abnormal about the cell, they're not going to create a pregnancy. Yep. So those 4 parts should be something that everybody should do and then what producers should expect from their veterinarian.
That all kind of follows along with your form that you're filling out as a veterinarian as you're going through these stepwise. But I guess let's just start walking through this and what you're looking at, what you're evaluating, and people can understand what to expect.
Sure. So let's start with the physical. That starts when the bull comes off the trailer at a veterinary hospital, or maybe if you're on the ranch, when they're working through the chute system, you're evaluating for lameness. So if the bull's lame, he cannot pass the breeding soundness evaluation. We're looking for any kind of heritable defects that may be a problem there, such as, if we find fluid on the hocks, and that could be a detriment to his long-term fertility and health as far as his hind limb structure. We're looking for anything that may be a problem down the road with this bull such as their feet and leg structures, is so important. Particularly hind limb structure is very important. We're looking to make sure that he can deliver good quality semen. So it doesn't matter if he's producing the best quality semen in the world. If he can't extend his penis because of maybe a penile wart or a persistent frenulum, that doesn't matter very much. And so we're making sure we examine the penis and the prepuce for no pathologies there that may prevent him from actually making intermission and delivering semen to the cow. During that process, we're examining the scrotum and make sure there's no abnormalities there with his sperm producing factory there, and make sure all the epididymis is normal, the transport area and the final maturation point for the spermatozoa. We're also palpating his accessory sex glands and making sure there's no abnormalities. Really a particular problem more in young bulls that are on high concentrate diets, but it's something that we are going to evaluate during that physical portion of the exam. Also, they must be able to see and travel and see cows in a sexually active group, so we want to make sure they don't have any abnormalities with their vision. We're going to do that, and that's really exacerbated even to a bigger point in bulls that are in larger acreages that must go out and travel and seek cows. And so, but it's really important part of the physical exam. And then sex is a luxury to a cow and to a bull, and so they can't produce good semen if they're in poor body condition. So we're going to evaluate overall their body condition score, assign that, and then maybe make some recommendations based on that. Bulls should be expected to lose 2 body conditions while they're out with cows in a very concentrated breeding program. And so we want to make sure that they're not going to have enough body condition to sustain themselves during the entire breeding season.
Perfect. Well, after the physical exam, we're going to continue to walk through the breeding soundness exam. We're here with Dr. Chance Armstrong. You're watching DocTalk. Thanks for joining us.
The seeds of financial security today with United Patriot Coins Precious Metals Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lidoband, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lidoband, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson with Dr. Chance Armstrong. We're at Auburn University, where Dr. Armstrong serves as an associate clinical professor here in the Department of Clinical Sciences and in the College of Veterinary Medicine, which is just a beautiful complex with fantastic people. We've been here and just had a great day. Thanks for the hospitality. You know, when we're talking about breeding soundness exams, we got the physical exam. Now the scrotal circumference is next.
That's right. And so we're going to measure these guys at the widest point, making sure that the testicles, there's no pathology with the testicles or the epididymis during that process, but we're going to measure them. And again, as I mentioned earlier, really is an inverse relationship when the onset of puberty and the daughters they sire compared to their contemporaries. For instance, If we had two brothers, one had a 38 centimeter scrotum, one had a 32 centimeter scrotum. The bull with a 38 centimeter scrotum, his daughter should come into puberty and into production, becoming more profitable for the operation earlier compared to his brother with the smaller scrotal circumference. And also they can cover more cows, so you may, a bull is a big cost to the operation, but a necessary cost, and may be able to cover more cows if his scrotum is larger. He has a bigger sperm producing factory there, essentially. And so those are really important and highly heritable, and something breed associations have really concentrated on for the most part over the last 20 to 30 years.
Is the scrotal circumference, is it the same across all breeds of cattle?
In the United States,
Okay.
according to SFT guidelines, it's acceptable per day of age. For instance, when they reach 24 months of age, they must be a minimum of 34 centimeters.
Perfect. All right. So after scrotal circumference and the physical exam, now we're going to
collect the semen, and so part of that is we palpate the bull and prepare him for a collection at the easiest possible way for him, less stressful way. We found this exam to be not painful based on some work out of the University of Tennessee, Dr. Whitlock there. And we collect a sample, try to get a clean sample. During that process, we're going to also examine the penis and the prefuse to make sure he can deliver that. We get the sample, we're going to look under the microscope to make sure these cells are moving. Minimum of 30% on our high-powered field must be moving in a forward linear direction, meaning they got to be going somewhere. They can't move in a circle, move backwards, or just oscillate in place. That's not what's considered progressive motility. And so doing breeding trials, we found that a minimum of 30% progressive motility will achieve those goals that we set forth for the bull, which are 63% conception rate every 21 days. At the end of 3 cycles, he should be able, in healthy cycling cows, be able to accomplish a 90 to 95% overall pregnancy rate.
To get started on the morphology, you're gonna then examine the sperm cells and
right. We're going to use a stain and actually kill the cells, and so we can examine and count a minimum of 100 cells, and he must meet a threshold of 70% normal of those 100 cells to be able to pass the breeding sounds evaluation. And we found that the morphology is critical because over the last 30 years, it is the most common reason for bulls being marked unsatisfactory or deferred classification.
That's great. And when we follow up here in the final segment, we'll talk a little bit about the difference in findings on the morphology and kind of the prediction for that bull.
Sure.
Thanks for watching Doc Talk. More with Dr. Chance Armstrong after these messages.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson with Dr. Chance Armstrong. We're at Auburn University's College of Veterinary Medicine, where Dr. Armstrong serves as an associate clinical professor. If you've read anything on bulls or you've rewritten the textbook on bulls and breeding soundness exams. This is special for me to be able to sit down and y'all need to soak this in and invite Dr. Armstrong to your VMA meeting or to your producer meeting, because he has a wealth of information. But let's talk about what we can determine from that morphology.
Yeah, the morphology exam is so important because just because I joke here because we're in the state of Alabama, but I tell students if they look under the microscope and they see something moving as far as the motility goes, and they call that bull a good bull to the producer, then the next thing out of their mouth should be Roll Tide, because that's about as good as their education is. So that gets a good joke here in the state of Alabama, and maybe it reaches out to other parts. But the morphology is something that we found in our 2018 review of the breeding soundness evaluation on the Bull Breeding Soundness Committee through the SFT. That was limited by a lot of veterinarians were omitting that, and we shouldn't be based on the literature. These cells need to be shaped correctly, and it shouldn't be a loss of DNA. The mid-piece is really important because that's where the powerhouse of the cell is, where all the ATP is made. And so that must be normal as well. So examining the head, mid-piece, and tail structure is so critical, and there's about 26 abnormalities that we can determine on the morphology assessment. And again, you must qualify 100 cells at minimum, and he must meet a minimum of 70% to be deemed normal.
And then we divide these defects into a couple of different classifications, correct?
Well, we used to. As of 2018, we changed the classification system based on the significance of the abnormality versus where the abnormality occurs, because you can have some overlap there, particularly with things like proximal droplets can occur with some type of environmental influence in both the storage area and also within the parenchyma of the testicle. And so we found that during that 2-year review of the breeding soundness, that we would be better served in this profession by looking at the more, understanding the significance of the abnormalities and providing a differential count. So what we do, as opposed to what you're talking about as a primary and secondary abnormality, that we worked for a long time, we found that did the service well. We did, subfertile bulls were not falling through the cracks if you were using that for many years, over 20 years that the profession used that. Now we're a differential count, much like other species that are evaluated, where we look for normal head, mid-piece, and tail. We get a differential count so we can follow these bulls, and also we can be better prognosticators for the producer. Okay, is this bull going to come back from this, or do we need to find another bull?
Yep, and that's what you're trying to determine with the morphology, right? Is this a problem with the sperm making factory or the sperm storage factory? And if it's the storage factory, we might be able to retest that bull.
Well, it could be, especially along with the history. If you have a history of something going on in that bull's, and like this time of year where bulls are coming back from shows and they're being purchased by other owners, we see the stress associated with that, and we can determine that bull could, with a little bit of rest and acclimation to his new environment and new feed, he can become breeding sound again. As opposed to bulls that have had a history and they're starting to degenerate, we can see that under the microscope on the morphology exam. and then tell you the difference. And also you can tell if those bulls are peripubertal, such as we see a lot of round cells being spheroids. Those are immature sperm cells that are released prematurely from the seminiferous epithelium. We see some proximal droplets in a 12 to 13-month-old bull, detached normal heads on that morphologic exam. That bull's still developing, and so we give him some more time. It doesn't guarantee that he is going to make the minimum standards, but it does tell us that he's peripubertal.
Perfect.
As opposed to a 6-year-old bull, we palpate some areas of the testicle that are a little bit firmer than they should be. We see a copious amount of proximal droplets. That bull is degenerating, and so he has a not good prognosis for the future of his breeding capabilities, and so maybe it's time to move on from him and get one to replace him.
Perfect. Well, thank you.
Yeah.
This was a great show. Folks, thanks for watching Doc Talk. Remember, always work with your local veterinarian. If you want to know more about what we do on Doc Talk, you can find us at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. Chance Armstrong, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.